and further, they go on to tell me that we're going to be able to move to a less invasive nasal swab that will save us PPE. We're running short on PPE, and that'll be less painful for you if anybody's ever endured having this done. Still not pleasant, but less painful. And it will save us on the personal protective equipment that we need. So that is very good news. I want to thank Tony Robinson, the Region 6 FEMA leader, and for that, and for the people at HHS, and for Jordan Cox at HHS as well. We very much appreciate their partnership on this. If our website, it looks like it's not going to be up, so I will tell you, if you go on the DallasCountyCovid.org, there is a link there, and it says "Got Stress," and then it has mental health resources. All right, so we're going through a lot as a community, right? And I'm seeing things in the community that are of great concern to me. I'm seeing a 6-fold increase in the reports of child abuse and domestic violence. So I know we're under a lot of stress, and you don't have to be an abuser to be to need these services. Regular folks need these services. You can click on that phone number and have a free call with someone who will help you. You can go to any of those links and set up an appointment for people that will help you. Those services are free to you, and we want to encourage people to use them. We are having some technical difficulties with our little televisions tonight, so I will move to, if they got it for me, and I don't know if they did, because like I said, we're having a ton of technical difficulty. Phil, do you have a copy of the report for today? Yeah, let me see the numbers. Okay, thanks. All right, so more somewhat preliminary, but good news. What we've seen over the last 6 days is we've hovered at our high days at around 100, and then on Monday, now Monday did have some low reporting because of a couple of labs being closed on Sunday, but on Monday we had a low number, and today we only had 63 positive cases, so that is a very good sign. Unfortunately, we suffered our 20th death today. It was a man in his 60s. He had some underlying high-risk health conditions and had been critically ill in a hospital for some time. Currently, about 70% of our folks are either over 60 or are known to have a high-risk chronic condition who are requiring hospitalization. And diabetes has been an underlying high-risk condition in about 29% of all the hospitalizations with COVID-19. So if you have diabetes, be particularly careful. And you can wear one of these. I'll give you a visual aid before I turn it over to Phil, and we'll answer your questions. You can easily make these at home out of 2 hair, what do you call them, those things that you put your ponytail in. And so you just take a cloth like this, you fold it over. Phil will show you too. It also has a tremendous way of making your ears get really big. But you put this on, you use the little things, you stick it on here. Now, my head's a little big for this one, but at any rate, you stick it on there, and that, Phil, I'll take that off so I can talk to you. Phil has the right size head for his, and this is one of his, so it's a little, probably not great for me. But the point of them is this doesn't necessarily protect you. It provides about 10 to 15% protection for you. But what it does is when we sneeze, when we cough, when we're asymptomatic and we don't know that we have it yet, it provides protection for those around us. What we need to remember, though, is a mask over your head does not mean you need to stay less than 6 feet away. You still need to maintain that 6-foot distance. If possible, depends on how the technology works, Phil's going to take you, or maybe just have to hold up a piece of paper and take you through some information that UT Southwestern, Medical City, and the other hospitals have been compiling that gives us a window into, at least medically, locally, what the guess is as to when this will peak. If that doesn't work, he can tell you about it, and we'll try to get it tweeted out or something. Phil?
So again, as the judge mentioned, 63 new cases reported today, so a total of 1,324. Also, in terms of at the jail, we are now up to, there were 6 additional inmates found to be COVID positive, so a total of 29 inmates, 2 detention officers. With respect to the long-term care facilities now, Monticello West has a total of 7 residents or staff members and 1 death. Skyline Nursing Facility has 32 residents or staff members, 0 deaths. Edgemere has 10 residents or staff members, 2 deaths. The Reserve at Richardson, 7 residents, 0 deaths. Westridge Nursing Home, 1 staff member. Brentwood Place 1 has 38 residents or staff members. St. Joseph Village has 1 resident. Villages of Dallas has 1 resident. And a new one reporting now is Brentwood Place 2, now has 2 residents confirmed positive. We also did provide more detailed information regarding some of the deaths that we've seen. We had the 20th death reported today. 85% of them presented at the emergency department or were hospital admission, and 3 were actually found deceased at home. 35% were less than 65 years of age, and 65% were 65 or older. 63% had some underlying health condition, and with 37% specifically having diabetes. And then in terms of race, ethnicity, 40% of the deaths were white, 30% Hispanic, 25% black, and 1% other. As the judge mentioned, we've been working with various researchers across the community that have been looking at various modeling, and we're trying to share practices with that, share information, and essentially there are multiple models out there. This is the one that was presented at Commissioner's Court last week. But in summary, really what it shows, and this just shows patient admissions, it shows ventilation needs, and ICU numbers. And so if nothing were done, that's on the left chart, that yellow line shows the number of total hospital beds that would be needed, and it'd be over 17,500 hospital beds. And it shows then the ICU beds is the blue line and others. But bottom line, 17,000 hospitalized beds would be needed if we had done nothing. As the judge mentioned, today we're reporting 63 new cases. All the interventions, the stay home, stay safe, are making a difference. It is flattening the curve, but we need to be vigilant in making sure that that everyone adheres to it. But on that track, based on our own data, it's suggesting that the curve is flattening. That top orange line, following sort of the pattern that we're seeing now, what you can see is the maximum number of beds there is a little over 500, as opposed to that 17,500. So it's a flatter curve, more drawn out, but it is definitely lower peak, and that's within the capacity that we have within our community. If you zoom back out a little bit, what we're also seeing, and it's hard to see, but this is that peak occurring towards the latter part of April, early May. But these are all subject to continued refinement as we get more information. All the researchers are sharing the information and trying to continue to refine the model. And again, there's the assumptions are clearly stated, but those keep, there are variables in that. But that's essentially, you can see the difference in those peaks. We are, based on our own data, flattening the curve. We're estimating that the peak right now may occur towards the end of April or the beginning of May, but this is all subject, it continues to change every day as we're experiencing it. And I'll just show you my own, again, it's really simple, putting it on like that and covering it, and don't touch the top, the front, and just take it off with that and clean it.
Much better job.
All right, thanks.
I believe that has us covered. Do y'all have any questions before we wrap this up?
This is a two-parter for Dr. Wong and you, Judge Jenkins. We're doing a story tonight about discarded PPE that we're seeing a lot of around Dallas. Could you tell us a little bit about that as far as like a possible impact, littering or breaking the law for doing that? Or has the county considered doing anything for littering PPE anywhere? And Dr. Wong, can you possibly talk about the safety impacts of that as well? Just in grocery stores, we're seeing, like parking lots, we're seeing a lot of it in just anywhere.
Okay. Yeah, and the question is about tossing off your PPE if you're wearing a mask or gloves to the grocery store and just throwing them on the ground. We certainly don't want that, right? Our grocery store workers are heroes too. They're out there being exposed to hundreds of people a day. If you want to take off your PPE, put it in the trash, please. And Dr. Wong, you want to get your part of the health concern on that?
I mean, as was mentioned, the purpose of these also is for people, it catches the droplets of someone who coughs or even while they're talking. So it would, potentially have contamination, so people shouldn't touch it, and should, certainly if they do have any contact with it, wash their hands afterwards, thoroughly. But, it's something that should be thrown away. Don't touch it if you see it out there, or, just handle it carefully and make sure washing hands afterwards. But
can y'all see if you can get the web page up with the phone number for these guys, the mental health phone number? Any other questions before we wrap up today?
The less invasive tests, can you maybe expand upon that at all?
Sure.
Because, yes, it would help save PPE.
Sure. Let me just read you in pertinent part from the question was explain the less invasive test. So I'll just read to you what our partner Erica Swartz, MD, the Deputy Surgeon General, sent me today. Additionally, the U.S. Food and Drug Administration recently approved the nasal self-swab method for use in testing patients for the novel coronavirus. This testing method is less invasive and is both safer for patients and healthcare workers. And so we're going to transition to that in the middle of next week. So essentially, I think I've seen this, y'all have shown it on some of the newscasts. What we do now is we tilt the head back, we take basically a long Q-tip like swab. We put that very deep into the nasal cavity and scrape off something to test, and we pull that out of your nose, and that's not pleasant, and people are, and we get dirty and you get dirty, and it burns the PPE on that. This is a self swab. It doesn't go in as deep. It allows you to do it, and so it's less unpleasant. And it saves us on PPE. All right. Any other questions?
Is there any concern that that there's still a limited amount of testing that could be affecting the numbers that we have?
Yes. So I am very concerned, and particularly we do a deal each year that Dr. Wong and Fred Cerise lead each 5 years, and they just finished one. It's called the Community Health Needs Assessment. In your newspaper today, let me back up. The question was, is there a concern that even with this testing, there needs to be more testing? And so that was a question. And in the Dallas Morning News today, they had a story that was covered by one of the television stations at Channel 5 last night, and it was showed some what I call red zones, areas where both the lack of insurance and the underlying conditions like diabetes, heart condition, will lead to bad outcomes if people have a spread of that through the community. And right now, we have limited visibility all throughout Dallas County on testing, and that stems from things that happen at the federal level, some miscues on the efficacy of the testing, some problems with the first batch of tests back in January and February, and that we're still at this metered level where we don't have enough tests either on the public side or the private side. I've got a call tonight with all the hospital CEOs, I think, at 5:55 to try to flood those zones, red zones in your newspaper, and what we already know about because Dr. Wong and Fred Cerise have done a community health needs assessment. And here's what we know. When people don't have health coverage, then there's not a pay source for medical providers to be in the community. And so what you've heard me talk about food deserts. Well, you also have healthcare deserts. And so these people that live in these healthcare deserts, and by the way, as I've said before, these are people who work for a living. These are largely people who work at the jobs that keep our economy moving, that pay less than $20 an hour. But in Texas, they have no coverage because unlike the other states that are experiencing these outbreaks, we made the dumb decision at the legislature for the last 3 sessions to turn down our portion of the Medicaid expansion money. So they're living in these places with no doctors. They have no health insurance, so they're not going to spend $150 to go to the doctor. And we have limited visibility into those communities because wherever the test is sited, it's the people right around that are most likely to go there. And so the insured people who are curious, who go to the doctor when there's a slight fever or a runny nose, are getting tested, and the people who have been shut out of the healthcare conversation in this state are not. And so we've got to find a way to, especially those folks, get into that community, get those folks the help they need before we have a bigger, broader explosion of this. Now, people may say, well, Judge Jenkins, wait, we all need more testing, and I'm trying to get all of you more testing. But I want you to remember this. If we have a reservoir of people who are sick, people who are in the hospital, people who are dying, that just prolongs this further for all of you. So if for the people that are chiefly concerned about the economy, this is why public health is called public health. It's everybody's health. Everybody affects you. And so if you're concerned about the economy, you better be concerned about us finding out what's going on in neighborhoods that have been shut out of health care, because the best way to get the economy moving again is to take care of people and keep them from getting sick in the first place. Yes, sir.
Speaking along those same lines, there's been several national stories that are showing that African Americans are dying from this at a higher rate. And you were talking about the health deserts. I know there are several throughout Dallas. How are you guys approaching that? What is your message to those people living in those deserts? Do you have any idea of what those numbers are? Are people coming from that segment of town sick, wanting to be tested but can't? How are you guys approaching that? So
Dr. Brian Williams is my special assistant over Health Equity. He was on the Don Lemon show on CNN. He's an outspoken person for Health Equity. We're thinking about that every day, and we've got a lot of work still to do. I mean, keeping that Ellis Davis Fieldhouse open for another 70, 80 days is a big help, but we got a lot more work to do on that. But you have an important role too. I'm sorry, let me say the question. The question was, what's my message to communities in these health deserts? And so we have a lot of work to do, and we're doing it. And I'll be having meetings tonight. I mentioned one at 5:55 on this very issue of health deserts. But you have a role to play in this too. You need to recognize that if you have heart disease, if you have diabetes, if you have underlying health conditions, it is imperative that you stay home. It's imperative that when you go out, you take every precaution that you can. I know we like to have family over. You know, I'm a big family person. I love to have my family over, but it's just not really safe right now. we need people to really limit those trips, or especially over the next 2 weeks. Limit those unnecessary trips outside the home. Take extra precaution if you're in a high risk, and that includes people that are over about 65 years of age. Take extra precaution. We're going to do all that we can to help you, but it's like every other thing where the food deserts, okay? We can do what we can to help, but we're not going to cure the injustice in this country, and particularly in this state, because the healthcare injustice in this state is probably worse than any other state, certainly in the sheer numbers of people that aren't covered. Just in my county, there's 500,000 people who work for a living that don't have health coverage. So we're not going to be able to fix that overnight. We need your help to keep yourself as safe as possible. We'll do all that we can do to keep you safe, and that's our mission, is to keep you safe.
Judge, can you tell us how close are we to possibly utilizing George Allen as a place where we house inmates? I think some have been in isolation, some that have tested positive. And how close are we utilizing the convention center?
So as of last night, I had a call on that at 10 o'clock last night. We had 22, I hadn't looked at it yet today, but we had 22 prisoners who were COVID positive, or persons who were COVID positive there. There was a concern on that call. It was one of our healthcare calls, with the spacing of people in the jail. We do have jail population down to about a little under 5,100 people. And I didn't say his question. Let me back up. The question was, what about the COVID positive cases in the jail? And is it possible that soon you will open the George Allen jail, which is a jail that we set up just for COVID? So that was what I was answering. Please remind me when I don't say the question. At any rate, so we had a call on this last night. There is, some concerns there, but Parkland Hospital, that runs our medical mod in the jail, is talking to the sheriff. I think they did that this morning. I hadn't heard the impetus of that, but there's several people looking at it. We're doing everything that we can to keep our jailers and our inmates safe. One of the problems with opening George Allen right now is a staffing problem. You can't just go pull police officers off the street because they're not certified to be jailers, just like you can't have jailers go on the street. And so we've got a staffing problem, and as people get sick, we have a more pronounced staffing problem. So we're not, as every other decision we're having to make, we're not in a perfect world on this.
And the convention center?
In the convention center, if there's anyone who has been living under a rock for the last week, we want the convention center. We want that asset here in Dallas, and I'm confident that we'll get it. I was pleased to hear from President Trump and answer in a press conference that the asset's not going anywhere. And so I may have a meeting tonight, or it may be early in the morning, a phone meeting with the commissioners to approve the contract if AACOM, our vendor, can get that done today. And so, again, we're not just going to put people into the convention center so people can say they have people there and take some pictures. That is a COVID step-down unit, and right now we're still slightly above 50% bed capacity at our hospitals. I forget, I think it's about 63% vent capacity right now in our hospitals. So we wouldn't take a patient out of a hospital like the $1.2 billion Parkland Hospital and put them at the convention center unless we needed to do so. There had been a press report, I want to clear this up. Someone said that we preferred to see the hospitals reel from patient capacity issues before we do that. And that's not correct. What we're doing is we're working with the DFW Hospital Association, and we're asking them, when does that need to be turned on? And when they tell us it needs to be turned on, that's when it'll be turned on.
In regard to the 2 drive-through sites, can you clarify how much federal support is coming and how much fiscal responsibility could fall locally?
Okay, so the fiscal responsibility locally is Dallas is providing the security and the traffic flow, the city of Dallas. Parkland is providing all of the medical care, but the tests themselves are being provided by the feds. And so we're and that was a question about how much are we spending on these two Ellis Davis and AAC travel sites. Let me just close in saying it is so important. You're beginning to get some good news, and we're beginning to see that your sacrifice in flattening the curve is working. But that doesn't mean you need to take your foot off the gas. We have got to stay focused on this mission. Staying focused on this mission is the best way to save as many lives as possible. And also of great importance, it's the best way to get us back to our economy working, people back to work, and these restrictions lifted as soon as possible. So please do not become complacent. Please take this one day at a time. Don't let this overwhelm you. Reach out to a friend or reach out to the numbers on the website if you need someone to talk to. But we can do this. You're proving it. You're doing it right now. And we will get through this just like people got through the measles epidemic in 1918 and life went on. So stay in the fight. Keep your eyes on the goal, and we'll talk to you again soon. Thank you.